Wellness Training. I'm highly privileged to introduce you, Dr. Smita, and thank you so much for being here. Thank you so much. I welcome Dr. Smita. And yeah, as connection was lost here, I welcome my Dr. Sharmila, the one who is presenting robotic advanced rehabilitation and gait movement analysis for upper quadrant for today's webinar session. Dr. Sharmila and I have a long association since our postgraduate days from Dr. MGR Medical University. I thank Dr. Sharmila for gracing this webinar series by accepting our invitation. Thank you so much, Dr. Sharmila. And over to you, moderators.
Good morning, everyone.
Good morning, Dr. Smita.
It's my privilege to introduce you all to the speaker for today's topic, Robotics, Advanced Rehabilitation and GAID, Movement Analysis for Upper Quadrant. We have with us Dr. Shamila Bano, who is the in-charge physiotherapist at Tumbe Physical Therapy Rehabilitation Hospital, Al-Jarf, Ajman, UAE. Dr. Sharmila has completed Doctor of Physiotherapy from Loma Linda University, USA. She completed her Master of Physiotherapy from India. She is also a certified lymphedema therapist trained from Norton School of Lymphedema, USA, and a certified vestibular therapist. Her area of expertise includes neuro and vestibular rehabilitation. She is also specialized in movement analysis. She has a total of 13 years of experience. She has been awarded by Loma Linda University for Academic Excellence and Dean List in 2018. She has been awarded by Gulf University, Medical University, and Tumbe Hospital Best Staff Will to Win. She was a speaker at Conference on Robotics Rehabilitation in 2018. She has participated as a speaker for Staff Health at Work organized by Ministry of Licensing Department, Ajman, in 2017. She was a speaker at Fitness at Work organized by Al Madina Medical Center in 2017. Dr. Shamila's other talks include vestibular therapy and its differential diagnosis, lymphedema therapy and exercises, NDT techniques and its enhancement for functional recovery in neurorehabilitation. She and her team is undergoing research in collaboration with Courier Company for robotics rehabilitation. I welcome our resource person, Dr. Sharmila Bano, to this much awaited session of the webinar series. Over to you, Dr. Sharmila Bano.
Thank you, Dr. Smith.
Yeah. Thank you, moderator, for the great support and good introduction. Today, everyone here, I can see 146 members are here around. And it's a pleasant day to start the robotic rehabilitation. And I'm going to show my presentation now, then we will start.
You can start
sharing now. Yes,
start.
I'm starting. Are you able to hear now?
Yes, ma'am, we are able to hear.
So I welcome all of you in behalf of Tumbe Physical Therapy and Rehabilitation Hospital. So today we are going to present a topic of robotics, advanced rehabilitation and GAIT, how we are dealing with robotics rehabilitation in Tumbe Rehab, and some insight about the movement analysis and upper quadrant. So this actually the webinar way accepted really because robotic rehabilitation is the next level of rehabilitation in our physiotherapy field. So you should have a awareness and you should have an insight about robotics, and you should have a knowledge about the robotics. As we know, all the departments and all the hospital will not have a robotics equipment. But if you're attending like this webinar, so you will get an idea of the robotics, and then your rehabilitation will get more introduced, and your rehabilitation will increase your quality. So what is the main my presentation topics was why we need technology. Why? The questions everyone will ask, because I have a good manual techniques, I can deal with my patients with my manual techniques, but why we need? So I'm just going to give us some idea of what that why we need it, and what is the benefits of using robotics in your rehabilitation, and how you can approach your traditional and advanced technology along with you, and then other with all equipments which we are using here. As we have robotic, it's a big topic and big equipments everywhere. We have a different kind of robotics, but what we are using, what we have seen the improvement in our patient. So these are the things I would like to discuss with you. And the end of the sessions is movement analysis for the upper quadrant. It is how you can analyze your movements in the upper quadrant area. So these are the main insect of my presentation. So before starting this one, robotic rehabilitation. Robotic rehabilitation, what it is? It is designed to support the administration of physical exercises for upper and lower extremities. So that's what the common in that robotic rehab. So whatever the equipments we are using, it's all designed to deliver the exercises. So what it will promote? It really promote the neuromotor recovery and neuroplasticity. And there is a evidence for this introduction. And as when you talk about the neuro rehabilitation, it has changed drastic changes. You can see why there is a drastic changes. What is the
Sorry,
effect of
sorry
hello?
to
Yes.
sorry to interrupt you, Dr. Sharmila. We are not able to see your presentation slides. Can you please just have a look on this?
Okay, I'll just try to make it up again. It's showing in your entire screen. Are you able to see now?
No, not.
It's showing shade. No. Now you can see.
No, ma'am, we are not able to see the slides. If you can see the present now option down, you can just click there. Yeah, now we can see. Yes, it's loading actually. Yes, yes, yes. Now we can see. Yes.
Oh, thank you.
Thank
Shall we
you.
start now?
Yeah, yeah, you
Thank you
please
for
start
it.
from here. Yeah, please go ahead. Thank you.
Now, the neurorehabilitation, when you come to the neurorehabilitation, it has a drastic changes from last 2 decades. But what's the main components of neurorehabilitation? Increase the cortical excitability and improve the neuroplasticity. So in this slide, just I have explained you what are the equipments we are electrotherapy devices, apparatus with transmagnetic stimulations, and robotic orthosis and robotic upper limb. Like that, many robotic rehabilitation equipments is available in the market now. The concept of robotic, when you use the robotic technology, it should be has all these components, like you should have a imaging and nanotechnology and biotechnology, data analysis, that is which is very important for the PTs, and therapeutic exercises and neurocognitive science and FAS and stimulations. So what these all components together, integration and combination of the technology for improving functional outcomes. So there, if all combination together in the robots, we will get a good output. I would like to share some researches of that. What is like 2010, Kuriana and his group, they did the research on that. They did the research on robot assisted therapy for long-term upper limb impairment after stroke. So what their research shows is robotic assisted therapy did not significantly improve the motor function at 12 weeks. It was in 2010. Then slowly the robotics technologies and their progression is improved. 2017, the research done by other Tijiana and his group, what they have concluded is a robotic device reduce impairment and activity related motor deficits more efficiently, more effectively than matched conventional arm training in subacute phase. So now the research is what they're showing is like that robotics rehabilitation is showing a lot of changes with the patients. So next is with a traditional and innovation approach. So we know as everyone has a traditional approach that's a basement for the PTs like neuromuscular facilitation, score and balance, neurodevelopment approach, sensory re-education and PNF and stretching and strengthening exercise. If all this traditional approach, if you combine with robotic rehabilitation, your treatment and your approaches will increase more. It means therapeutic robotics, posture control technology, and virtual reality tool. These are the common tools which is available in the market. So what if you combine together, your improvement will be more. So that's what this presentation I'm going to show how we have combined and then how the progression we have seen in our patients. So the research is also shows in 2011 they did it in that robotic therapy combined with conventional therapy more effective than the conventional therapy alone in patients with greater motor impairment during inpatient stroke rehabilitation. So that's what the main concept was combined with your conventional therapy with robotic therapy, you will get the good results in that patients. And we do have evidence too, and then we do have a bit control with the patients too. The next which I have told you why we need robotics is that many of even my classmates, even my colleagues have said, I don't want robotics. I have a good hand skills and I can may improve my patients with that hand skills. Of course, that's true because hands is very important for our PTs. But some kind of needed robots for the patients too. And from avoid the postural stretch to the therapist. So of course we are dealing with the patient. So you might get the postural stretch while doing the treatment. So robotics will help you to reduce your postural stress and present the exercise as a game. Why we wanted to make it as a game? Because to increase the motivation with your patient and provide more intensive rehabilitation training. It means intensive, repetitive, and rehabilitation training. It means when if you give a manual therapy, your repetitions will not be more than the robotic rehabilitation. Because why? The robots, you're not get stress, and even the patient will also enjoying with as a game. Okay, and the next is improve the confident level of the patient. Because the holding of us and holding of robotics, there is a lot of difference to improve the confident level of patient and to get a quantitative feedback. This was a very important when you deal with the robotic rehabilitation. I will show you in my next slide what feedbacks, what the quantitative analysis you will get it. Because when you do the balance training, when you do the walking training, of course we are counting through our scales and then our normative scales. But when you do with the robotics, you will get the exact analysis through the robotics technology. So this will be the great benefit if you use the robot and do innovations in the therapeutic approach. Of course, when you start using robotics, it will create the innovations. So the patients also get motivated with you and they will feel there is some kind of innovations with our rehabilitation approach. And other thing is provide accurate visual feedback. That's feedback is very important for each patients to get a good improvement with the patients and learn motor capacity in their new motor control system. So that's what we need the robotics when you are doing the rehabilitation. Then next is I spoke about the benefits. Why we have to use the benefits? It will be most positive and motivated and intense and repetitive movements you get it and motor relearning and engaged and visual feedback during therapy and accurate documentations you will get it and to improve the quality of life and independency. That's what you have to use. Why we need a robotics, what is the benefits of robotics. Next we will move on to, so actually I mentioned before there is a lot of innovative rehabilitations robotics is available. Now I would like to show you what we are dealing here in rehab hospital. One is the wearable exoskeleton and core and balance technology and sensory feedback technology. It's like automated rehabilitation technology and upper limb robotics and virtual reality equipment. So we are dealing all with these equipments with our rehab patients. And moreover, we are getting great improvement and great progression with the patients. And we do combine with the manual techniques along with the robotics. So first I will just give you some insight about the exoskeleton, which is useful for the gait. And as you know, this equipment, I'm not saying about about the equipment, but what has helped us for the rehabilitation. So the main this is to design to help stand and walk during rehabilitation. So this robot rehabilitation helped us make the patient walk independently, even the muscle power is zero. And this has a wearable exoskeleton, and which picture I showed you in this, like when Paralympic cricketer, he did not walk even 20 years because he was got a spinal cord injury. When he came visited our hospital, we tried to use for him, and then first time he is standing with this equipment, and he expressed his gratitude that like he stood up and he walked within 20 years after. So now I'm just going to give you some about the case study, what we are dealing, so that you will get an idea about that, how the rehabilitation and robotic rehabilitation help with our patients. The first case study which I would like to discuss with you is a 31 years female. She has difficulty in standing and walking, and bladder and bowel control is not there much, and severe orthostatic hypotension. The patient came here with us, severe orthostatic hypotension, and she got a RTA in 2018, 6 incomplete spinal cord lesion. And when we do the assessment, her upper limb power was mm 3 by 5 and lower limb was 0. Postural hypertension, no bladder and bowel control, no sitting control. So when it came to us, when they referred by the doctor, they said she had a severe orthostatic hypotension. We need to do for her some standing techniques. So what we can do it, as because she has a muscle power 0, we cannot make her stand. We try to use the braces and we try to use the table. The orthostatic hypotension was not changed. So we decided to put for her in robotics, like which I showed you before. This is the first case study. The next case study which I'm going to share is 20 years old male, difficulty in walking and imbalanced gait, and right side hemiplegia due to birth hypoxia. It means the person having a problem since birth, and he was doing continuous long-term physiotherapy, but her family members was told us like why this patient is not walking properly, because he's taking long time durations when he walk for a particular steps. So that was the main chief complaint from them. It's a meaningful complaints too. And his muscle power was like 5 in upper and lower limb, because he has a good muscle power. And then right upper limb 3 plus 5, and right lower limb 3 plus 5. It means it's can manageable. The patient can manage and patient can walk, but his endurance level is not much good. So his time up and go test was 20 seconds. 10-meter walk test was 0.51 minute he took for 10 meter, and bug balance case was 40 by 56. Okay, so this was the basic assessment, like initial assessment when we did for these two patients. And you can see the video of this first case study which I discussed, UC6, incomplete paraplegia, incomplete quadriparalysis, I think. We started the first day exoskeleton grade training with the upper limb strengthening exercises, and as usual upper limb strengthening, but she cannot walk even 2 to 3 steps with the exo with the 3 to 4 minutes. Then we did the 5 session of therapy with her, and she is walking and talking. With the 5 days of session, she was able to walk and she can talk. Her orthostatic hypotension is much better. And now this patient is taking continuous physiotherapy with us, and then through this exoskeleton. So in that way, see, now the robotic rehabilitation helped us to make her goal to achieve. The next case which I would like to discuss with you is same the patients which is hypoxic birth, hypoxic hemiplegic. He was taking long duration, slow steps while walking. And we did the robotic rehabilitation with him. His endurance level has increased and 10-meter walk test is improved for him. So within 0.32 seconds, he can do it. And he's improved his balance and coordination exercises. It means this long time he had a problem of this endurance levels. We did the rehabilitation with the robotics, so it's helped him. And meanwhile, we continue all our basic range of motion strengthening, neuro entity techniques, and balance and core balance techniques. All we have continued along with them. So we have combined with robotics along with the conventional therapy. This is this is talk about these second case. Now the third case, which is same 22 years old female, and she has a difficulty in walking and feeling of imbalance. And due to seizure, she undergone craniotomy on 2017. After craniotomy, she developed the right CVA, and she came to us. She wanted to walk with the proper way, because as she's using her stick while walking, she doesn't want to walk with the stick, because as she is a student, she wanted to go to college, her meaningful complaints. So we wanted to solve that complaint. So what we did it, of course, we continued all the exercises, but still the patient has a fear of walking without stick, because she had fell down 2 3 times. So the fear of fall was there with her, even though she is a 22 years old female. So while doing the assessment, she has a left dorsiflexus weakness. It was 1 by 5, and left lower limb muscle power was 4 by 5, and her back balance was 36 by 56. Spasticity was 1 scale, Ashworth scale 1. So the same thing we did with the robotic rehabilitation. This is after 10 sessions of gait training of exo, balance and coordination and stretching exercises. So it was a 10 days duration, and back balance scale was improved. And you can see without stick, she's walking, doesn't have any issues. From us, and she's going to her school and without any stick, and she's walking comfortably now. So this was the first robotic which I'm going to explain to, especially on the gait. So what we are facing with the gait problem, because the gait, the patient has a fear of fall. The fear of fall is more, and there is control is less for them while making them walking. But these kind of robots will help us to make them to walk properly, and these kind of robots will help them to understand the movements, how I have to shift the weight, how I have to control the movement. These all the things the robot itself training with the patient. So this will help us for the rehabilitation to do properly with the patient. So these are the some videos which I am showing you. See, as we were doing with the gait training, we can do the pre-gait training with the robots. Okay, so here the PT assistance is very less, but the patient is getting complete pre-gait training. And gait training, this gait training with a minimal support of the robot support, the patient is walking. So here the PT doesn't need to worry about that, the posture, the position. It's everything is controlled through the robotics. And the squatting training can be done with this robotics with the proper position of squatting, the hip flexions more than the knee flexions. So in this way, the robotics has improved us, and moreover, the rehabilitation was very meaningful for the patient. And even in our department, if we have a robotics, the patients will get insight of, okay, there is advanced rehabilitation which is going on with our hospital. So that's what I'm just including you, is include your treatment along with the robotics. So this is a one kind of robotics which I'm going to explain you regarding the gait and standing. The next important component which we will deal with the patients with a neuro rehabilitation is a gait, is a balance. Okay, before going that, I want to tell you about this kind of robots. What are the helps we are getting? There is a different kind of modes is available for them. The first step, pro step, even 1 2 3 like this other robots has, and they have is like a degree 1 degree 2 degree 3 like that it is there. If you see the first step is, which means like the person doesn't need any muscle power. Even the zero muscle power person can stand with that robotic, and the zero muscle power person can walk with the support. Okay, the second step is the pro step. The pro step is the patient has a minimal muscle power. It means 2 to 3 muscle power. So, but they can shift their weight load, and then we can take the patient to this kind of mode. That is a pro step. And the third one is pro step plus, which is the patient has a good power above 3, but the patient has a difficulty of walking imbalance, and then the initiation has a difficulty. You can take it a pro step 3. So each robotic has a different approach. You can use it as a first, pro, and pro step. Even zero muscle power to the good muscle power, we can make the patient to walk. And even everyone was asking about the evidence. Of course, there is a evidence for each robotics rehabilitation, but this particular kind of robots which we are using in our hospital, they have a good evidence of that. They have when TBI patients, cerebral palsy, multiple conditions, multiple sclerosis, and ACA and stroke. So all the conditions we have a good evidence. So what their evidence is, this slides I took it mainly for what the evidence we got it from this robotics. The first evidence is what they're showing is low effort while obtaining the physiological benefits of improved circulation. And the second one is high physical strain during session by lowering the robotic system. It means PT can also induce high physical strain during session by lowering the robotic assistance. The physical strain is less when you increase the robotic assistance. That was this evidence was showing. And improve gait and speed walk, gait speed and walking distance and balance and motor activity and control while in the devices. And it means if you have a control, you can increase the speed, you can increase the distance, you increase the balance. And walking distance, the early evidence of pre and post assessment also shows increased gait speed, walking distance and balance, and mobility independence, and reduce spasticity and pain, and may improve this body's composition and bowel and bladder function. This bladder as well as lower extremity strengthens like psychological well-being. So these are the components is increased when you use the robotic rehabilitation. So we do have evidence for this kind of robots. Okay. The next two robots which I'm going to show you is the main is the balance. Okay. The first, the component which we will concentrate more on standing and walking. The second, which is more for the PTs, are core and balance. Okay. We do have a core and balance for robots, but see, some kind of equipments you need a proper analysis and proper assessment with them. So this core and balance techniques which has we have a two kind of balance training. One is a sitting control training and standing control training. So they have a sensorized platform of seat and then floor. So what if the person is sitting, there is sitting control training can be obtained, and the robot that the platform will move. The patient has to sit on the seat and the platform will move. So what will happen in that? The patient will develop balance control. It's like how we are using the wobble board, the same kind of pattern, but through that we will get lot of quantitative analysis and the confident level of the patient. So this I would like to include you some case study with this balance core and balance technology. Well, he is a 61 years old male. He has a difficulty in standing and walking, feeling of fall while walking. He developed pulmonary embolism and DVT, and developed weakness and bilateral foot drop since 2016. So he came to our hospital around 2018 because since 2016 he was taking a treatment and he improved a lot with the basic level of treatment. But the next level he was having a fear of fall, and his problem is like using a cane and walking. That's what his main problem. And the second one is he wanted to walk without the cane and fear of fall. These these two things we wanted to drop this one. So what we did it, we tried the upper limb robotics with the exo, but he was not comfortable with that because he's working good because he want to know, he want to have a balance. So next we thought, okay, we'll try to use for him in this core and balance technology. So during his first assessment, his like dorsiflexor weakness was MMT was 1 by 5, and proximal left lower proximal muscle was 4 by 5, and left is 3 by 5. Okay. Bird balance scale was 34 by 56 during the initial assessment. So this was the weekly 3 times with 3 weeks training with him, because as we have to give a gap for him because he had a pulmonary embolism and easy to get fast tired. So the technology which I'm showing you in the picture is like it should giving a feedback to the patient and how to stand properly, and they have to control their trunk. It means if the trunk is not controlled, it will show to them like you have to control. So it is going on extension and flexion. So this technology is giving a feedback to them how to balance here, and the platform is moving for him. So this kind of training we gave it to him for weekly 3 times. And see this independent walking before, pre and post for him. Okay, he was walking without stick, and now alhamdulillah he's walking without stick, but still his foot drop is not get solved, but without that also he can balance himself because he got a confident of walking. But the next case study for the same core and balance which I wanted to discuss with you is this. He has a difficulty in walking and doesn't want to walk in the cane, difficulty in using left upper limb. So this patient, this came with us December 31st, 2006. He developed stroke. He came from Nigeria, and he 2007 he got a left shoulder surgical dislocation, left shoulder dislocation. So he has undergone for surgery, and 2006 he got a stroke. From 2006 to 2018 he was using completely cane, and he is not walking independently, he's using the stick, and moreover, and then he has a fear of fall lot. So he came from Nigeria to us. Just he see all the technology which we are using here, then he's thought, okay, I'll try here how much I'll get the better with this. So okay, then we started with him core and balance technology, because as stroke he was walking very good, so we doesn't want to go for the exoskeleton. So we tried same core and balance, and his upper and lower limb muscle power was in right and 5 by 5, and left he has 3 by 5, and upper limb 0 by 5 for him. But he has a good control in knee and hip, and the muscle power was 3 by 5. So we started using for him the same core and balance technology with him, and he got a good feedback. Like before, he used to hold the rails and then he used to control. After this